What if everything feels normal in pregnancy, but the baby has already stopped growing? This is called a miscarriage, and many women don't see it coming. What is a miscarriage? A miscarriage happens when the baby stops developing, but the body does not recognize the loss immediately. There may be no bleeding, no pain, no warning signs. Pregnancy hormones can stay high, so symptoms like nausea or breast tenderness may continue, making it emotionally shocking when discovered. Silent warning signs. Some subtle signs may include sudden loss of pregnancy symptoms that stop progressing, brown spotting, not always present, mild back pain or pressure, uterus measuring smaller than expected, no heartbeat on ultrasound. Important: many women have nitrogen monoxide symptoms at all. Diagnosis is often made during a routine scan. Why does a miscarriage happen? Common causes include chromosomal abnormalities, most common, severe fetal development issues, placental formation problems, uncontrolled thyroid or blood sugar issues. It is not caused by stress, walking, lifting, or food. What happens next? Doctors may recommend waiting for natural miscarriage, medication to help the body pass tissue, D&C procedure if medically needed. Emotional support is just as important as physical recovery. A miscarriage is silent, but the pain is real. If you've experienced this, know this: it was not your fault. Follow for pregnancy awareness and honest women's health education.